All right. So I'm going to be talking today about IPE, which stands for Interprofessional Education at NEOMED. And I will put out there right at the beginning that Nicole and Sarah work very closely with me on interprofessional education. And so I invite either one of you to chime in with additional information at any point, and might ask you to do so. So there's your heads up, I guess. So we're going to define interprofessional education. We're going to talk about the ICPAC competencies, which is the Interprofessional Education Collaborative and the competencies that they have developed. We're going to talk about IPE specifically in the College of Medicine at NEOMED. And again, Sarah might be able to chime in with a little bit more information about things in the College of Pharmacy. We'll talk about some of our successful initiatives, some of the challenges that we face, as well as opportunities. So what is interprofessional education? The World Health Organization sort of has the definitive definition, which is that interprofessional education occurs when two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. So the thing that I want to highlight about this definition is it's not just putting two different professions in a room and having them listen to the same lecture. It's really meant to be more interactive than that. There really should be learning about each other and from each other, not just co-located in the same space while they're learning. And the purpose of interprofessional education is to really ensure that healthcare professionals enter the workforce prepared for collaborative practice. And this is really what happens every week at these ECHO sessions, right? We have multiple healthcare workers from different professional backgrounds who are providing comprehensive services, essentially by working together to provide the highest quality of care across a variety of settings. So you guys are all experts in interprofessional education, whether you knew it or not. ICPAC, I mentioned ICPAC a few moments ago. ICPAC stands for the Interprofessional Education Collaborative, and it is a collaborative to promote and encourage its constituents' efforts that would advance substantive interprofessional learning experiences. So the goal, again, is to prepare future healthcare professionals for enhanced team-based care of patients and ultimately to improve population health outcomes. ICPAC started out with 6 associations belonging to it. Those associations represented the health professions of dentistry, nursing, medicine, osteopathic medicine, pharmacy, and public health, but it has expanded dramatically since its inception, and it now includes over 21 professions, or I believe 21 professions, 21 associations. ICPAC developed a set of core competencies that really help to guide interprofessional education curriculum for all 21 of those associations. We're going to talk briefly about the 4 broad domains that those competencies fall within. So there are a number of competencies within each of these domains, but we'll just talk about the broad domains. The first domain is values and ethics for interprofessional practice. And basically what this means is that they want to encourage folks to work with individuals of other professions to maintain a climate of mutual respect and shared values. The second domain is roles and responsibilities. And that's really the idea that people should use knowledge of their own role as well as their knowledge of roles of other professions to assess and address healthcare needs of patients and to advance, again, the health of populations. Interprofessional communication refers to communicating with patients, families, communities, and professionals in other health fields in a responsive and responsible way that really supports the team approach. This can be tricky because all of our professions have their own lingo and their own jargon. And so it's not just as simple as, oh, I'll go and talk to this other professional that I work with, because oftentimes we speak very different languages. And then the last domain is interprofessional teamwork and team-based practice. And this is applying relationship building values and the principles of team dynamics to perform effectively in different team roles to plan and deliver and evaluate patient care and again, population health. So those are the domains that ICPAC really looks at. And again, there are individual competencies that fall under each of those domains. NEOMED, as many of you may already know, is an interprofessional medical university. So we have a College of Medicine, we have a College of Pharmacy, and we have a College of Graduate Studies. And our College of Graduate Studies contains a number of programs, and that number seems to be growing. I was going to say by the day, maybe not quite that frequently, but it certainly has expanded pretty dramatically in the last couple of years. We have a Master's of Medical Science in Anesthesia. We have a Master's of Public Health. We have an integrated pharmaceutical medicine program, a Master of Foundations in Medicine, global global health. So a variety of programs, and I didn't name all of them, that fall within the College of Graduate Studies that are related to the healthcare professions as well. We have developed a working group in which representatives from all 3 colleges meet regularly to discuss interprofessional education opportunities in our curriculum and to ensure that we're all meeting the requirements that are set for interprofessional education by our accrediting bodies, because this has been recognized by all of the accrediting bodies, for medicine, pharmacy, and so on, as being something that our students need to demonstrate competence in prior to their graduation from their respective programs. So as I mentioned, Nicole and Sarah, the 3 of us all sit on this working group along with some other individuals from the university to help collaborate and work on the interprofessional education curriculum that all of our students experience. The College of Medicine specifically has 3 program objectives that are related to interprofessional education. And you can see that these pretty closely align with the domains that I discussed that ICPAC has set forth. So those program objectives for the College of Medicine are that students, by the time they graduate, should be able to communicate clearly, respectfully, and completely with interprofessional healthcare team in written and verbal forms to exchange information and to minimize medical error. The second is that the students, again, by graduation, should be able to collaborate effectively to provide a team-based approach to efficient, safe, and equitable patient care. And lastly, by graduation, our College of Medicine students should be able to demonstrate an understanding of team dynamics and leadership skills that support and enhance interprofessional collaboration and team functioning. So what does our curriculum look like at NEOMED? What is the 4-year interprofessional education curriculum look like? In the first year, unfortunately, we've had a lot of competing curricular demands, and our interprofessional education content no longer has a place in the first year of medical school. And that's something that we're hoping to remedy. We had foundational concepts that were embedded into the first year, as well as some evidence-based medicine sessions, journal clubs that students used to do in conjunction with other colleagues from the College of Pharmacy. And the students also used to participate in an in-person interprofessional simulation related to poverty. And unfortunately, those activities were all taken out and shuffled around for a variety of reasons. There was a major curricular transformation within the college a couple of years ago, and that led to some content being removed, and we see that as an opportunity for the future. So the students in the College of Medicine really get their introduction to interprofessional education currently in their second year. Really, it's in the summer between their M1 and M2 year, which technically counts as their second year. They have a summer session where they have an interprofessional panel. It's actually just happened probably about a month or so ago. The students were given an introduction to interprofessional education, to ICPAC and the competencies that I just mentioned. And then they had an opportunity to listen to an interprofessional panel where a team discussed a very complex pediatric case that involved a number of healthcare professions, as well as ethical and legal considerations as well. In the fall of their second year, our students participate in an LGBTQ interprofessional session along with the College of Pharmacy. And then in the spring of their second year, they have an interprofessional education session that is related to end-of-life care issues, and that is done in conjunction with Kent State University and does include some assessment. The bulk of our College of Medicine interprofessional education activities really occur in the third year, and many of them occur in a course that I oversee. It's technically a 3-course series, PPC 6, 7, and 8. PPC stands for Patient, Physician, and Community. And it's a course where a lot of material falls that sort of is going to be important to you regardless of what medical specialty you practice. While they are in that particular course, the students complete a module, an online module that's from the Caring with Compassion series. This is actually a free series. Any of you could create accounts and log into it. It talks about roles and responsibilities of various members of the healthcare team. And it also walks through some challenging scenarios that these healthcare teams might face together. The students also participate in an interprofessional team training workshop. This is a workshop that is put on in collaboration with a variety of universities and colleges from all across Northeast Ohio. And the students work with a number of different students from other healthcare professions, nursing, advanced practice nursing, pharmacy, occupational therapy, physical therapy, exercise science. I'm missing several. And those students all come together and first they learn a little bit independently about team steps, and then they come together as small groups and learn about one another's roles and responsibilities and work through a case. And then ultimately come up with a care plan related to that case that they present to a simulated patient or a simulated caregiver who presents them with some challenges to their plan. So that's an exciting workshop where the students really get to take on their professional roles and work with colleagues to problem solve. The students also participate in a simulated echo module, which again, Nicole and Sarah are both intimately involved with this project as well. Some of you may have heard about this. I think we presented on it a couple of years ago. So if you were on that session, you may have been familiar with it, but the students all participate in a 3-session simulated echo in their 3rd year of medical school. They first learn a little bit about what the echo model is and why it's important to their future training and career. Then they participate in an introductory session where we reiterate some of those key points and sort of let them know what's coming up for them. In the 2nd session, we as facilitators present to them a didactic and a case presentation. And the theme of our simulated echo for the students is social justice. So we present a redlining didactic and then a case that focuses on social determinants of health. And the students participate in discussion elements after both those didactic and case presentations. And then they work in small groups and come back for a 3rd session where they present either a didactic or a case presentation. So we get 2 didactics and 2 case presentations per session, again, on the theme of social justice. This has been a really popular module. The students really enjoy it, and we've been very impressed by the level of discussion that they have and the presentations that they bring forward. I tell the students, and it's absolutely true, I learn something brand new every time they present because they really have given some excellent, very current, fascinating presentations. And again, Nicole and Sarah can feel free to comment on their experiences as well. The students also participate when they are on their psychiatry clerkship in an interdisciplinary case conference with students from the College of Pharmacy. And that is a session that's led by an interdisciplinary team as well. I helped teach that session along with Sarah from College of Pharmacy, as well as Dr. Eric Messamore, who works in the Department of Psychiatry. And during that session, the students get some didactic information about the use of clozapine, as well as other antipsychotics. And we talk about the shortened life expectancy of individuals who have severe and persistent mental illness. And then they, again, work through a case together and think about what members of the interprofessional team would benefit this particular patient and what would be an optimal care plan and how would they work with the patient to implement that. And then whenever the students are on their clinical rotations, they are being observed clinically in one of the domains that they are assessed on, both in 3rd year and 4th year, is their interprofessional collaboration. So I want to talk for a couple of seconds about that simulated echo piece. Again, we've gotten really great feedback from the students about it. I've put a couple of quotes here that came on end of course evaluations from those students, or I think these are actually the evaluations that they filled out immediately after they completed the simulated echo series. You can see we got comments like, this experience enhanced my comfort level with collaborating with an interprofessional team by providing an environment that allowed discussion. The more experience I get collaborating with my colleagues, the more comfortable I'll be in the situations in the future. Greatly enhanced my comfort with collaborating with an interprofessional team by allowing us to work together on a presentation and provide our own unique expertise to collaborate together. I always enjoy interprofessional teamwork because it shows each of our unique perspectives on a topic, and I learned so much from it. It reinforced the importance of using other people's expertise and skill sets to provide quality care. Increased my knowledge of the different skill sets and areas of expertise that different professionals bring to a patient care setting. So again, we've seen a lot of really kind of glowing reviews from students about being able to participate in a simulated echo. And I thought that might be of particular interest to this group that's obviously feels the same way about the echo model. We also got some more quantitative data from these students. This data is actually a year old. We just got the new data for academic year 21-22, and it was pretty similar. You can see that the vast majority of our students felt that this particular activity was either very applicable or somewhat applicable to their development as a future physician, and that many of them said that they would be very likely to participate in echo programs in their field in the future. So that's pretty exciting as well. I'll also just mention briefly, Nicole does host a echo elective for our fourth year students. And since we implemented that experience for all of our third year students, there's been an increase in the number of students who have been interested in learning more about the echo program when they're in their fourth year, which is pretty cool too. So some of the challenges that we face with interprofessional education, I already mentioned the challenges we've had securing time within the courses. Most of the activities that have been eliminated, particularly those in the first year, were really not eliminated because they weren't seen as valuable, but they were eliminated because they've been displaced related to competing curricular demands. And so that's an ongoing challenge. We have a number of scheduling conflicts when we're trying to work with other colleges, and sometimes that planning occurs a little bit too late or on different timelines. We might get approached and say, hey, can you do this activity when we've already approved courses, and so on. Physical space is a challenge. If we're trying to do something in person and we're trying to combine students from the College of Pharmacy and the College of Medicine and possibly the College of Graduate Studies too, we're looking at a very limited number of spaces within our university that can actually hold the number of students that we're trying to accommodate. Resources and faculty availability are an ongoing challenge, not just for interprofessional education, but there are a small number of us who are really doing the bulk of these interprofessional sessions. And so trying to make sure that we get other folks on board and trained and available to participate is an ongoing challenge as well. And then making sure that we're adequately assessing our students. We do have assessments. The activities that I mentioned all have assessments attached to them, but we could certainly make them more robust. Some of the opportunities that we've identified or goals that we have, we'd love to introduce more of those foundational concepts in the preclinical years. Again, you saw that the vast majority of the students in the College of Medicine are getting most of their IP experience a little bit later in their curriculum. We'd love to be able to resecure some of that additional time in the College of Medicine curriculum for preclinical activities. We would love to enhance the administrative support that we have for the scheduling challenges and the planning timelines and the space requirements, as well as secure those sufficient faculty resources, and again, enhance our assessment tools. So with that, I'd love to open it up to any questions that you have or ideas that you have for interprofessional education and how we could make it better for our students, because eventually they're going to be joining you in the workforce, and we hope that they're ready to do so in a productive way. Those were some of my references, and I will stop my share so that we can chat.